After the transfer, just make sure that the handle on the wheelchair locks in place, and that way it don't come off when wherever they go with their family members, or if they're just going to sit in a wheelchair and watch TV. You don't want that handle coming off. Also, don't forget that if you're going to do a sling transfer, it takes two people to transfer them, you and your coworker. And just make sure that you put the sling right underneath their neck, or some of them like it above their head, but that one's kind of like, I don't like that like that. If they like it, that's fine, but I normally put it right up, right about halfway up their head. That way you can put their head right in and it don't hurt them. But if it gets too far up, then they're sitting in it too far. But just make sure that when you put it, there's a middle tab in the middle of the sling. Just make sure that that's going to line up to the middle of their back, and then roll them back, and then roll them towards you, and then have your partner, your coworker, is going to pull the sling out, and it should be evenly on both sides. If it's not, just tug on it a little bit and it'll go. If it's, just a little bit, depending on the patient. If they're a bigger patient, then just have them roll again, tuck a little bit in, and then pull some out. When you get the HOYLE, if you're going to use a HOYLE, of course, make sure that the beds is not too high, not too low, because sometimes it won't clear the bed because it'll be too high, and then you'll have to put the bed down just to get the patient out of bed. So what you want to do is, there's different colors on the slings. There's 4 sides. So if you're going to get them up in the wheelchair, you want to try to use the first one, which is normally a blue color. And then if you use the blue color to sit them up in the wheelchair, the next 2 ends that are towards your feet, those are going to be green. So blue and green, and they'll set them up. If you're going to lay them flat, like on a shower bed or something, then it can be both the same colors. It could be red, red, blue, blue, green, green. It doesn't matter, because they're going to lay down flat. But you don't want to use the same colors if you're going to set them in a wheelchair, because you're going to have a hard time. They're going to be flat, and you're not going to be able to pull them back in a sitting position. It's going to be dangerous, so don't do it. Use the red, and then if you use green on top, then you just jump to the next color on the bottom. So if you go, blue, then you use green on the bottom. If you go green, then you're going to use, I think it's red. So that way they're always sitting up. And then once they're sitting up, you push the HOYLE with the patient on. Make sure that your coworker has a hand on the back of the sling, and then you put them right over the wheelchair. And then normally I get in the back just so I can pull them back straight. And then as I pull them back straight, my coworker will lower the patient, and the patient will go all the way to the back of the wheelchair, which is where they need to be. If they're too far to the front, they're going to sit forward like this. You're going to have to, both of you, either you do it with the HOYLE, or once you do that, you lock the wheelchair, and both of you get the sling, one on each side, and then 1, 2, 3, and you pull the patient up to the back of the wheelchair. And that's the safe way of doing it. Just one on each side, and make sure that you guys count 1, 2, 3, and on 3 you do it. And then once you leave the sling there, that way after wherever they get back, if they go to therapy, or if they go to lunch or whatever, if they come back, even if they can stand at therapy, a lot of times they'll be too tired when they get back, so you just HOYLE lift them. And then if they say, if therapy comes back and tells me, hey, you did pretty good, I think you can stand and pivot, I'll give it a shot, and then normally they can do it. If they say they can do it, they can do it. And then I'm like, okay, I just keep the sling on there for emergencies, because a couple of times if they're just barely making it right now, and they may have a bad day where they just get tired, and so if that's the case, you don't want to push it, then I'll Hoyer lift you back. I heard you did a lot today, and they'll tell you, I did real good, and so if they did good like that and they're tired, then just Hoyer lift them back in bed. They'll get there where they'll be like, nah, I don't need a sling no more. I'm gonna get up. I know how to get up, and you'll know that you be like, oh man, you did everything. I just kind of make sure you didn't fall. So with that being said, so we got the sling out of the way, and then of course when they come back, you do the same thing. You hook it up, and then of course when you hook them up and they're going back to bed, like I said, just use the same colors. Blue, blue, red, red, yellow. It doesn't matter because they're going to be flat. Just make sure when you go over the bed, that the bed's not too low because you're going to hit it. So make sure the bed's high enough. You go underneath it and lower the patient down, take the sling off, roll them, take it out, roll them, push it, then roll them this way towards you, and then your coworker should be able to pull the sling right out. And when you do that, that's a good time to check your patient too. So when you pull the sling out, before you have them roll back, just have them take a peek. They're probably dirty. Take the brief off, and then you can do it, but have them roll back after you take the sling off, and then take the brief off and change them, and they'll be set for a few hours. After they get back or whatever, they probably can eat lunch, and then after that they're watch TV and wait for dinner, and then they're good until a couple hours go by, and then you can go check on them. Now, I don't forget, I always do that with help. Never do it by yourself, because it is state law that you do it with another coworker or someone that knows. A CNA, a nurse can help you. You can get any nursing staff to help you, but no one else can help you. I had other people from the kitchen or whatever that try to want to help, but no, you can't use their help, because something happened, you're going to get in trouble yourself. You're going to be in trouble, so don't do it. And so if you're, especially if you're doing that at home with your family member, just make sure you get help from like your brother, your sister, your uncle, your tío, your aunt, anybody that can help you transfer your loved ones safe. Just use common sense, and always use the right equipment. Whether it's going to be a slide board or a lot of times if the patient goes home, you can get the insurance to pay for a Hoyer. It's not like at the hospital, but at least it's a hand pump one. But it's very useful. Matter of fact, a lot of times that's the only way that you're going to get them up to the wheelchair, or to the restroom, or to the shower. So mind you that it'll take practice, and it'll be a little intimidating at first, but once you get the hang of it, it'll be a piece of cake. You'll be able to get them where you need to be with the Hoyer or the slide board. And then if they can stand and pivot, then that's a different story. Then of course you want to put the bed, a lot of times they want to put it too low, and then they got to get up I always put the bed after I get them dressed and put their shoes. Make sure that if they don't got no shoes, it's mandatory that they use non-slip socks or shoes. But if they don't got no shoes, of course, go get some non-slip. They cannot get up barefoot if they're gonna slip. And then put the bed, I always put it up to right when their feet are about ready to come off the ground. Like I see their feet, and then when their toes are just there, I'm like, okay, that's good. And then they're gonna slide to the edge again, and they're gonna be even lower. So if it's too high, they're gonna low up a little bit. And then of course use your gait belt on them, and don't leave the slack. Just pull it tight, and then make sure 2 fingers can fit in between that, and then let the patient know, okay, are you dizzy? Okay, you're not? All right, we're gonna stand on 3, okay? And then he's gonna say, okay, or if he does it, and you say, we're gonna stand on 3, okay? and then get his attention or her attention, and then they say okay, and then of course you're gonna count, 1, 2, 3, poof, go up. Don't do like me. Sometimes I go 1, 2, 2.5 now. But I know my patients. That's when they know me. They ain't gonna stand until I say 3. But it's good to joke with your patients and laugh with them. Tell them a joke every once in a while. I always tell them I love my patients. I always tell them I love you. Have a good day. I hope you do good in therapy and I hope that you go home soon. So keep up the good work. Do all that and say, I'm ready to. Before you know it, they're gonna say, I'm ready to go home. And on that being said, on my next video, I'm gonna make sure that I have a little surprise that I'm gonna show you. Hopefully, my sister is back. She's my my test dummy. She's my patient. So hopefully she's here, and I'm going to show you a few things that we'll be able to go over. And make sure you comment and like the video and subscribe, please, please. It does a lot for the channel. Now that I know, it does a lot. And just tell your patients you love them, and if you're struggling, just go outside, go take a break. It's tough. So don't be too hard on yourself. You get tired, you get frustrated, go outside, go to the restroom, wash your face, just take a deep breath. And, ask a co-worker, to give you a hand or something, and make sure you help. If you want help, don't forget to help. Always ask, hey, you okay? Do you need a hand with anything? And that'll go a long ways. If you ask them, believe me, they're going to ask you, and they're going to come back and say, you went to lunch, you're going to come back and, oh yeah, I did this and that, They'll do things for you. Believe me, there's good people that are in nursing. A lot of good people that are nursing. That's why we're here, is because we all want to help these people, and we want, and the only way they're going to get better is with us, with our help, and of course the nurse and the doctor. It's a whole team, but we're the closest ones. We're the one that sees the patient the most. We're the ones that deal with them every day, maybe 3, 4, 5 days in a row. Where some of the nurses are there 3 days, so we get to know them. I know I get to know my patients really good, and a lot of times better than my nurses. But that's not a knock on my nurse. They're just doing other things, and that's why they depend on you to, like, if you see a new something on their skin, or a new, like when they went to therapy, they came back, they got their arms bleeding, or they hurt, anything, you let your nurse know and document it. Put it in the computer. Make sure you document everything, and we'll go over that too on documentation on PCC. And I hope everybody's got the same thing. I know every place that I've been at has the same computer of the PCC, just the same program. With that being said, I just want to tell you guys thank you very much for everything. I love you guys, and I hope to see you guys soon in the next video. And with that being said, I love you guys, and have a good day, good night. I love you.